Hi, I'm Dr. Daniela Stein. I'm a medical doctor and I have a special interest in functional medicine and lifestyle medicine, holistic medicine, and I'm the author of the international bestseller Thrive Through Menopause. In this video, I want to chat with you about one chapter in the book. It's chapter 4, and it is called Mindful Menopause. So even if you can't read the book, I really want you to know this because I want you to implement it in your life so that you can thrive through menopause. I want you to have an incredible experience when you go through menopause. I don't want you to just survive or just get by. So one of the things I teach all my clients that I see in my clinic is mindfulness throughout their menopausal journey. And the reason is, I quite often people come to me, I'm a family physician, so people will come to me with a main complaint of something else. Their complaint would be that they feel very irritable, or they feel very stressed, or they feel maybe depressed, or they get physical symptoms, headaches, stomach upset, not sleeping well. They might experience different symptoms which they don't even connect to menopause. So it is quite important for me that everyone should sit down once a day and just have that little bit of space where you can pause and reflect. And it creates that space where you can really connect the dots. Because I'm in that position to tell my patients, you know what, symptom A, B, and C are all related to menopause. It's not your family driving you crazy. It's not your job that's horrible. It is not joint pain or that you're too old for exercise. It's really all perimenopausal symptoms. But I can do it for my clients. I can't do it for you because I want you to do that for yourself. To read my book, to really help you know what menopause is all about, and then to sit and reflect and to see if the symptoms you are experiencing, if it could be menopause related. And mindfulness, there is a lot of science behind that people who live a more mindful life have a better outcome, are healthier, have lower blood pressure, a lower risk of heart attack, lower risk of illness. And so what I mean with mindfulness is to become aware, to create that space for yourself where you become aware of what you're feeling in your body and what you're thinking. It's almost as if you're looking from the outside at your thoughts. And when you get mad and angry at something, to step back a little bit and to just ask yourself, why are you getting mad? Why are you getting angry? What is your goal with getting angry? Because quite often our goal is not to upset everyone around us. Then why are we reacting in a certain way if we're not really reaching our goal with the way we are reacting? There's many ways to help you to be more mindful. Something I advise everyone is breathing exercises. So with breathing exercises, it's a good relaxation technique. It's a good way to kind of get back in your body. You can implement it during the day. It's free. I advise it in hospital. I advise it to my patients that have pain or people with anxiety, people with panic attacks. I advise breathing exercises. So what it does when you do deep breathing exercises is when you take a deep breath, it distends your diaphragm, which stimulates your vagus nerve, and your vagus nerve stimulates your parasympathetic nervous system. And that is our relaxation response. So when you're stressed out at work, or you're on the go, or go, or you're caring for aging parents and teenagers, and you're all stressed out, the whole time your body's releasing cortisol, your sympathetic nervous system gets triggered and you're a little bit stressed the whole time. That's what increases your cholesterol, your blood pressure, increase your risk for heart disease, cancer. When you stimulate your parasympathetic nervous system, that helps you to relax, it helps you to be calmer, it helps you to be present. You can do it now where you are at home. You can take a deep breath in and then put your hands on your chest to feel how your lungs expand. And imagine your lungs like a balloon that's expanding. A deep breath in, that balloon is expanding, and then slowly out. And a deep breath in. And slowly out. You can do this when you wake up first thing in the morning. You can do it at night before bedtime. You can do it every time you have a coffee or a lunch break. You can do it when you go for walks. To just be intentional about your breathing. Do deep breathing, slow everything down a little bit, and then kind of just take notice of yourself, where you are, how do you feel? Do you have tension in your forehead, tension in your neck, tension anywhere in your body? Does anything hurt anywhere? I work as a doctor full time in a big busy hospital, and I'm often on the go, I'm just doing things. And when to be honest, I set an alarm on my phone to go off to remind me of doing this, because when we're busy, we forget. And when I take this mindful moment for myself and I just feel what I feel in my body, I often notice that I'm thirsty, that I may be hungry, that I maybe need to go to the washroom, because in the day I'm just go, 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 and I forget to pee. So this really helps me to connect with my body, and that helps me to be more present with my next patient, for you, with your teenager kids, with your parents, to be less irritable, with your husband, if you just become more aware. So that's very helpful. So I chat more about that in my book in chapter 3. It's called Mindful Menopause. And I really recommend it wherever you are in your menopausal journey. I recommend it for anyone. I recommend it for all my patients. But specifically, there's science and research how being more mindful during your menopausal journey is really going to elevate you. It might be just that missing key to take your health and your happiness and your joy to the next level. When you are mindful and you are aware of things that frustrate you, you can avoid those things, or you can step out, you can just keep track, you can next time be less reactive. If someone says something horrible that usually annoys you or trigger you, you can recognize it and you can choose to not become annoyed. So that was chapter 4 of my book, and it's called Mindful Menopause, and I really feel you'll find that helpful. Watch the next video where I'm going to discuss movement during menopause. And it might be exercise during menopause, might be a bit different from what you anticipate. So really watch my next video, Movement in Menopause.